Getting started on Caistin as Trianam for inhalation solution. Hi, my name is Mary Lester. I'm a respiratory therapist and a clinical coordinator at the Anton Yelchin Center for Cystic Fibrosis at Keck Medical Center of the University of Southern California. I've been a respiratory therapist for over 40 years, and I've been working with people who have cystic fibrosis for over 20 years. I've trained hundreds of people on how to take their Caistin, and today I'm going to show you how to set up your Altera nebulizer system, how to prepare and take your Caistin, and finally how to clean up when you're done. Before we get started, there are a few important things your doctor should have told you about Caistin when it was prescribed. Caistin is a prescription inhaled antibiotic used to improve breathing symptoms in people with cystic fibrosis who have a lung infection due to Pseudomonas aeruginosa. Caistin is not a treatment for infection caused by other bacteria or viruses, such as the common cold. Caistin is used only with the Altera nebulizer system. It is not known if Caistin is safe and effective in children under the age of 7 or in patients with an FEV1 of less than 25% or greater than 75% predicted. You should only take Caistin as your doctor prescribed and should not take Caistin if you are allergic to Aztreonam, which is also known as Azactam. You'll be taking your Caistin using the Altera nebulizer system. Keep in mind that the Altera nebulizer system is designed for use with Caistin only and should not be used to take any other medications. Your doctor has also probably prescribed you with an inhaled bronchodilator. Bronchodilators are used to help relax and open your airways and may help you avoid having bronchospasms. If you don't have an inhaled bronchodilator, ask your doctor to prescribe one for you. You should always use your bronchodilator before taking a dose of Caistin. If your doctor has also prescribed a mucolytic or mucus thinner, it should be taken before you take your Caistin. Mucolytics help to thin the mucus in the airway so you can cough it out of your lungs more easily. The recommended order to take your therapies is bronchodilators, mucus thinners or mucolytics, airway clearance techniques, and lastly, inhaled antibiotics such as Caistin. Doing your treatments in this order will clear your lungs of as much mucus as possible, which will then allow Caistin to reach into your lungs and fight the Pseudomonas bacteria. Your doctor has probably already explained that you will be taking Caistin 3 times a day for 28 days. Once mixed, each Caistin treatment should take about 2 to 3 minutes to nebulize and should be taken at least 4 hours apart. Having a flexible dosing schedule means that you can take Caistin according to your schedule, as long as you take it 3 times a day with at least 4 hours in between each dose. So for example, during the week, you might do your first treatment before work or school at 8 a.m., your second when you get home at 6 p.m., and then do your last one before going to sleep at 11 p.m. But if you like to sleep in on the weekends, you might wind up doing your first treatment at 11 a.m. instead of 8 a.m. You should have no problem fitting in the 2 additional treatments later in the day. Just make sure that you always wait at least 4 hours between doses. You can find this dosing dial on Caistin.com and use it to help plan out your treatment day. If you have any questions, be sure to read the full instructions for use that came with your Caistin shipment. You can also find a copy online. Go to Caistin.com, click on the patient information link.